Hello, I'm Dr. Preston Smith with University Pediatric Urology. I'm now going to talk to you about orchiopexy after surgery care. Orchiopexy is when we tack down or bring a testicle down, and it's a very common procedure that we do. Most commonly, these children are 6 months to teenagers in age, and they are done under general anesthesia, either at the hospital or at the surgery center. Most undescended testicles that we bring down with an orchiopexy have two incisions, one up high in the groin, near the bladder, if you will, off to the side, and another one down in the scrotum or the sac. Sometimes we just have one incision down in the sac, but usually there's two. We always use absorbable sutures, so you don't have to worry about removing any stitches. The higher incision up in the inguinal area or the groin usually has stitches hidden under the skin and some type of glue, tape, or bandage on top. We encourage that you just leave that alone and remove that in 7 to 10 days. That doesn't really have much medical purpose. It's just trying to keep the skin edges together so your child can have a prettier scar. So if that happens to come off too early, you're welcome to tape it, put a little sticker on it, anything to try to keep the skin edges together. But we would not quickly run and re-glue it or sew it again. It would get infected if we did so. Down in the scrotum or the sac, there's dissolvable stitches. Usually you can see those. Some of those are under the skin you may not see. And again, there's nothing to do there. If you do too much scrubbing and wiping within the first 7 to 10 days, you might accidentally kind of pull the skin edges apart and then you have a little gap and it just takes longer to heal. So we encourage just showers only for about 7 to 10 days and just lightly pad the area. Because again, the more you scrub, probably the more harm you're going to do. And this is true even in the babies. Even the babies that pee and poop all over this, the infection rate is very, very low. And in my opinion, if they were to get an infection, it would have happened at the time of surgery, not because they were home being dirty. So I would encourage you not to do too much cleaning in the early time after the surgery because you're probably going to do more harm than good, and it's not necessary to be clean. Now, your child can do almost anything after an orchiopexy. What I personally like is I like to restrict that they do showers only for 7 or 10 days. In other words, that they don't soak underwater because then they get too soggy. So showers even the day of surgery are fine with me. Also, I try to prevent activity between the legs. So that would be straddling. That would be like riding a bicycle, riding a horse, four-wheelers, bicycles. Those things, again, putting them up for 7 or 10 days is probably a good idea. Otherwise, your child can do anything they want. Now, another one of my providers may ask you to go longer without activity or limit activity. So you should go by what they recommend. But in general, if you follow this, I think you'll be fine. Now, these tend to look painful because they're bruised and swollen, but they usually don't hurt that bad. And so nowadays, with our trying to avoid narcotics, we usually will give your child a narcotic dose at the time of the surgery, the day of. And the older children, we might send you home with a prescription for a few doses of the narcotic, but most of the time we're trying to avoid those altogether. Usually Tylenol or Motrin are adequate for pain management, and so I would highly encourage you to just use that, okay? Now, if you have a wound concern, again, calling us is not going to be helpful. It's illegal for you to send pictures and us to do anything over the phone. And it's really hard to describe. So if you have concerns, it's better just to come see us than call us because we won't be able to help you over the phone much. We're always available Monday through Friday, of course, and we're always responsible for what we've done. If you feel 3, 7, 14 days later you have a red hot tender incision either up above in the groin or down in the scrotum, please come see us because you may be the rare wound infection and we would need to treat that. We prefer you not go to the emergency room or your primary care. We would prefer you come see us even if it's quite a drive and you live far away. The concerns you would have really is probably not much of anything except for, like I said, a wound infection. Even a separated wound a little bit we don't do anything with and it should heal in fine. Now we do ask our orchiopexy patients when we bring a testicle down or tack a testicle in place to follow up with us in a month or 2 if you're doing well. So you would need to call our office and make an appointment to do so. You can call us if you have big concerns during the day to our nurses and they might be able to answer a few general questions. But again, if it's about a wound or a discoloration or you think it's too swollen, too bruised, you would just need to see us. That, I think, is all you need to think about, is a little bit of pain management. Try not to be too clean in wiping our incisions. Try to keep the dressing on for about 7 or 10 days if there is one. And try to also let them air out. I know you don't want your kids naked all the time and your little baby's getting cold and all, but if they can get some air, especially down below in the first few days, so maybe wear a big t-shirt, loose boxers, maybe a robe, have a little naked time, that'll help it breathe, dry, and scab and heal quicker than putting Vaseline and that type of thing on there. I always discourage any type of ointments, especially Neosporin. If you use Neosporin, you're liable to get a little skin yeast infection, and then you trade a problem for a problem. So again, come see us if you have any issues immediately after surgery in the first few weeks. Otherwise, we'll see you a month or two later. And we do always appreciate you trusting us with your children. And visit our website if you have other questions, because this video should be available for you on our website as well. Thank you.